Good afternoon. Thanks for joining Family Caregiver Alliance for Take Charge Advanced Care Planning Tips. I'm Calvin Hu, Education Coordinator at FCA and your host for today. For 4 decades, FCA has been working across the Bay Area and the nation to improve the well-being of family caregivers. We offer support through consultations, classes, workshops, retreats, publications, and advocacy. Now, if you'd like to learn more about FCA or access our online resource center, CareNav, please visit us at caregiver.org. So during the webinar, your phones or microphones are going to be muted. So if you have any questions, you can use the Q&A box on your screen. We'll answer as many questions as we can at the end of the webinar. And we'll also be asking you to provide a little bit of feedback at the end. And I'd like to thank you all in advance for filling that out. So today I'd like to welcome our guest, Mary Mathieson. Mary is the Chief Strategy Officer with Mission Hospice and Home Care in San Mateo. It's one of the original and still independent nonprofit hospices in California. She's led awareness initiatives on end-of-life issues internationally and supports the innovative educational offerings at Mission Hospice. Mary is also very passionate about engaging partners to create compassionate communities for those living with serious illness, death, and bereavement. So now that you know a little bit more about our presenter, I'd like to turn things over to Mary.
Thank you so much, Calvin. Thank you to Family Caregiver Alliance for the opportunity to share this information. And thank you to all of you for joining us today. This is a message that is deeply passionate for myself and for the work that we do at Mission Hospice. And today I'm going to give you a whirlwind tour in about 45 minutes of some tips for advanced care planning. And then we'll have time at the end for questions. And as we begin, I'd just like you all to reflect for a moment on why this conversation matters to you now. What brought you to want to learn more about this today? Do you have personal experiences, or as we are all living in a pandemic, is this something that you are sitting with questions for yourself now? It is important that that you reflect on what matters to you most as the foundation for any of your advanced care planning. And this is coming from both our perspective at Mission Hospice and the patients that we are fortunate to care for at the end of their lives, as well as those of us who have lived this experience, as I have personally with family member as well, that starting with what matters to you and why it matters as you hear the rest of this information is going to be key in how you communicate this to others. Next slide, please. Next slide. And why it matters. In California, it's been research that actually 90% of adults say that talking about end-of-life care is important, but less than 30% have actually had this conversation with family members themselves. And additional research shows that nearly 90% of doctors aren't comfortable starting this conversation with patients. So a lot of times people think, oh, it'll be time to start this when my doctor brings it up. But what we have learned is it's important for you to take charge of starting this conversation, both with your family members and with your physician, in order to not have assumptions made. Next slide. Next slide. So in this short session, this is an abbreviated version of a 2-part workshop that we have offered in the community in our Bay Area. But the steps that I will be walking you through are: think about what matters most to you, talking about your wishes with your family and friends, choose your healthcare agent, and write it down and share your plan. So it's 4 simple steps, but each have lots of information. Next slide. And yes, thank you in the chat. I see someone's mentioned doctors are reimbursed for having these conversations. And as we get to the end of the presentation, that it is still something that you want to initiate with your doctor. So step 1, thinking about what matters most to you and what kind of care you would want if you were unable to speak for yourself. And just a couple of tips and prompts as we go through this for you to think about as we go through the session today and following. Next slide. So here are a couple of phrases, and these phrases come from some cards that have been researched and are used in helping people to start these conversations. The cards are available at the link below from Go Wish, and there is an online solitaire game that you can play as well with these cards. As we look at these now, just these 5 simple phrases. If you were trying to communicate to someone what would matter most to you if you couldn't speak for yourself and were seriously ill or nearing the end of your life, would any of these things be important to you as you look at these phrases? And if so, what would they mean to you? Now, many people will look at these and say they're all important. Some might be more important than others. But these are ways to help clarify some phrases to start, and then explaining to those who are in your family or in your advanced care directive some of the things that really matter to you, and how might you help communicate what people could do to help you get what you want. To maintain my dignity is something that a lot of people say is important to them, but what would that mean to you? Does that mean to be kept clean? Does that mean to have a private space? Does that mean to be able to still do as much as possible for you? These are all ways of starting to think about what would matter most to you. The not being connected to machines. Unfortunately, we've seen so much in the last year with COVID of people being connected to machines in their last days. And these are things to be thinking about. If you had a choice and were not able to speak for yourself, are these things that would matter to you and would help you start that conversation? Next slide. Again, a few more to be able to communicate, not be in bed all the time, to keep my sense of humor. These are phrases I've heard someone say, so long as they could still watch their favorite sports game, as long as someone, you can personalize these as much as you want, but what are some of the things that really matter to you that kind of help define your quality of life? And that's the foundation to support what matters most to you for all of your decision making. In the card deck and online, as well as in workshops, we also say there's a wild cards, the questions. Think about some of the things that would matter most to you that you know you've experienced with others in your life at their end of life, or if they were seriously ill, or for your own illness. What were some of the things that really, really mattered to you? To have someone have nice sense around you, or to have no sense around you, to have people support your belief systems, prayer, readings, music, or simply to be able to get out of bed. These are the kinds of things that you want to be considering as a foundation for your advanced care planning. Next slide. So once you've thought about those things, really thought about helping to define what quality of life means and some of the things that would matter most to you at the end of your life, you want to be able to talk about these wishes with your family, friends, and your doctor. And next slide. The key people that you want to talk about your wishes and what really would matter to you. Those closest to you, whoever you define as your family and or your close circle of friends. You want to make sure that anyone directly involved in your care is aware of what matters most to you in your advanced directives, and anyone who might be involved in your healthcare decisions. And oftentimes people struggle with how do I start that conversation with anyone? Especially if you're well and healthy now. And certainly a goal is that all of us are having these conversations for our advanced care plans and advanced care planning way before an unexpected event or need happens, and certainly anyone living with a serious illness or chronic condition. So if you are well and healthy at this point, you can start the conversation by saying, even though I'm okay now, I want to be prepared for the future. Or even though things look fine now, we know that we're living at a time that things can change at any moment. I've heard people say, I'm okay now, but I really want to make sure that all of in our family or a circle of friends, that we don't have happen to us what's happened with others, Uncle Joe's family, or people not knowing what the wishes were. And the second here, simply phrase statement. I went to a workshop today and they said we should talk about our wishes for medical care, our wishes for what we would want if we weren't able to speak for ourselves. So these questions and tips and more are in the Take Charge workshop, workbook that is online as well. And we'll give you that link at the end of this session. So there's a printed workbook that we have online available that you can get this information. One of the things that you will be needing to explore are your wishes for specific medical treatments and care. And I will touch on just a couple of those now before we move to the next slide. With the tips for the planning and talking, we don't go in depth today on the medical decision making, but I know that there are questions about this. So I do want to give just a little bit of background to you all. They're in an emergency situation for advanced care planning. And especially in light of COVID, but this was true before COVID. There are probably 3 or 4 key medical interventions. If your heart were to stop beating, if you were to stop breathing, that you would want to be aware of your medical decision making. There's much more information on this online, and you'd want to talk to your physician about it. But those are CPR, cardiopulmonary resuscitation, intubation, and ventilation. A newer one with COVID is, would you want to go to the hospital or not in the case of a serious emergency if your heart were to stop or to stop breathing? Now, many people would think, of course I would want to go to the hospital, or of course I would want these treatments. But the reality is that the treatments don't always bring you back the quality of life that matters to you, which is why we spend more time on the think about what matters to you. So in any medical treatment questions, although there's lots to pursue and learn more about, and in longer workshops, we go into that in more detail. The simplest question that I could offer you in these, in making these decisions for your medical care, if my heart were to stop beating, or if I were to stop breathing, with whatever my current conditions are, your current age, your current medical conditions, would these treatments return me to the quality of life I have now or better? Or what would the likelihood of that outcome be? And that's a question that you can ask a physician. It's a question you can get some information on, given whatever your current medical condition is or age. These are all statistically based answers, and there's certainly gray area in all of this, but just very high level for key medical decisions. If you're uncertain what the outcomes are, please do not take what the media shows us on a daily basis, not the news stories, but the television shows of the benefits and outcomes of some of these interventions, CPR in particular. I think 80% of people receiving cardiopulmonary resuscitation on emergency medicine television shows end up going out to dinner after that happens, or dating the physician on call in the television show. And that's not the case, especially for the seriously ill or frail elderly. And so knowing what the statistics are on that and having your questions answered about the likelihood of returning your quality of life can help you have a conversation with your physician about decision making for medical treatments. I apologize that's so brief in the time we have. I want to cover the whole spectrum of the 4 steps to advanced care planning, but there you would want to find more information about that for your care. Next slide. Thank you, Calvin. So once you've thought about what matters most to you, you know some of the people you need to tell, and you've got a couple of phrases that might help you begin. The real key step legally and the main purpose of advanced care planning is really to choose your healthcare agent. That's someone you want to make decisions about your care if you were unable to make decisions yourself. The inability to, if you were unable to make decisions for yourself for any reason, short-term or long-term, your healthcare agent is the person who you legally give the authority to make decisions, medical decisions on your behalf, if you are unable to speak for yourself. And your inability to speak for yourself may be if someone's had a heart attack, a stroke, dementia, mental incapacitation, and it can be for permanent or short-term reasons. Certain medications and certainly people on ventilators are unable to speak for themselves because of the tubes, etc. So there's a number of reasons why someone might not be able to speak for yourself. It's important to remember in advanced care planning that so long as you are able to speak for yourself, you make your medical decisions. The only time an advanced directive and advanced care planning comes into play is in case you are unable to speak for yourself, and your healthcare agent is the one that you name to do that for you. Next slide, Calvin. So the first 2 steps in this, you need to know what it is that would matter most to you and some of the decisions you would want made. You need to know how to start the conversation with those that you might choose to be your healthcare agent. And that is all in preparation of choosing your healthcare agent. Your healthcare agent is someone, as you can imagine, that needs to know your wishes and values. And in part, going back to step 1, where we focus on what quality of life means to you and what matters most to you, because no one has a crystal ball of the circumstances that will always be unknown to us and most often be a surprise, where we might find ourselves in an emergency situation, unable to speak for ourselves. And because we can't know every potential medical intervention that might be needed, or every treatment option or every choice, you can't know all of that when you're trying to make decisions in advance of a crisis. What you can know are some of your key values and wishes. And if you are very clear because of certain conditions you have, or the potential, the outcomes or the burdens of treatment might outweigh the benefit of them in certain circumstances, your healthcare agent needs to know those things. Your healthcare agent needs to respect your wishes, even if they're different from your own. So many people have chosen their spouse, if they have one, to be their healthcare agent automatically. But maybe their spouse has very different wishes or values about what matters to them at the end of their life than they do. So long as your agent is willing to respect your wishes and put their own aside, then that would be a good choice for you. But if you have any question that they would not be able to do that due to religious or spiritual or cultural beliefs, due to just personal values and beliefs, you would not want to choose that person as your healthcare agent. It's also important that your healthcare agent be a strong advocate. This is the person that would be able legally to speak to your physician, maybe an emergency physician in a time of crisis, and learn what the situation was, what information was available, and be able to advocate on your behalf of what mattered to you in order to make treatment decisions. I always say, if you're choosing your healthcare agent and you know maybe it's a wonderful friend or family member, but they wouldn't return a meal if it was cold in a restaurant or something tasted wrong, they probably aren't the person that would be a strong advocate in a healthcare setting for you. So you do want to make sure that it's someone who would be willing and able to speak up for your wishes. And also someone who could be calm in a crisis. And I know this is a pretty big list here, but many of us have and will be healthcare agents for others. And the most important is that they know your wishes and values and would adhere to them. A couple of things legally, and this is in the state of California. Some state laws are different around this, but your healthcare agent cannot be on your current healthcare team. And if you live in an assisted living or nursing facility, they also cannot be a member of staff. And those are important precautions so that the person making decisions on your behalf would not be someone who is directly involved in your care and treatment. There is also, for those who do not have a family, friend, someone that you would choose as your healthcare agent, there are fiduciary services, both for financial powers of attorney, for your financial needs, if you were unable to speak for yourself. And what we're talking about here, this is healthcare, naming your healthcare agent for, there are fiduciaries for power of attorney for healthcare. So this is all for your advanced care healthcare planning, and your healthcare agent would either be a family member, a very good friend, or there are licensed fiduciary services. Next slide. And I will get to as many of the questions as possible in the Q&A. So once you have thought about what matters to you, talked about it, chosen your healthcare agent, and actually had the conversations with them about would they be willing to be your healthcare agent? Do they understand what matters most to you and some of the healthcare decisions that you would be choosing or not choosing for your own care? Step 4 is to write it down, document your wishes, and share your forms with your agent, your doctor, and your loved ones. Next slide. So an advanced healthcare directive, and this is a directive that you create in advance of a crisis for your healthcare wishes. And the physician order for life-sustaining treatment are the names of 2 documents in California. And then after we've gone through the documents, we'll talk about sharing your plan. Before I do that, the advanced healthcare directives, I will say, and the physician order for life-sustaining treatment. Depending on what state you're in, there may be different forms. So you want to look up advanced healthcare directive in whatever state that you are living in or a family member may be living in, to make sure that you are using the appropriate document in that state. The physician order for life-sustaining treatment, there is a similar form in most states, but not all now, and some are called a MOLST, medical order for life-sustaining treatment versus physician order. So again, they may be slightly different forms and slightly different names. You want to make sure you're using the appropriate forms for the state that you reside in. Having said that, next slide. There are many different forms nationally and in each state, and that makes it very confusing for the public, but they are many of the differences are the level of detail about those first couple of steps. The far left form on the far left is available on our website, which I will give you the link to at the end of the session as well, is the California State Form for Advanced Healthcare Directives. It is the most basic and straightforward. It is a legal document. It has spaces to add things about your wishes and values, more detail about the care or treatment you would or wouldn't choose depending on your personal circumstances. But it's pretty much the nuts and bolts of the steps that I will outline for you. The other forms here that are shown, and there are many more, go into greater or lesser detail about your wishes and values under different circumstances, and they can be really helpful as guides for you to think about and communicate more of your wishes. We have some additional resources on our website as well that you can click through about different decision making and choices and conversation starters. Having said that, depending on the healthcare system that you are in, they may also have their own form in their online medical record system. All of this to confuse us, I know, but that's not really the case. It's just to make sure that it's in the system for the healthcare or insurer that you may have. So I'll speak a bit more to that as we get to sharing the forms. The main information on each of these forms, though, is the same about designating your healthcare agent and choosing to give guidance about the medical decision making that you would choose or not choose if you were unable to speak for yourself, and finally having the forms witnessed. Next slide. Let me go back just to the advanced care planning forms just one more moment. Thank you. So on the advanced healthcare directive form, the first statement is to put your name and that you designate the person you name as your healthcare agent. That's the very first part in any of these forms. And that is the only legally binding element of your advanced healthcare directive. It is allowing the healthcare service to share otherwise confidential medical information with the person that you have designated be able to make those decisions on your behalf if you can't speak for yourself. There are then two spaces for alternates, and we recommend that you name more than one person as, or one person and two alternates as your healthcare agent. In the advance of a sudden need, your first choice may not be available. They may, for their own reasons, may not physically or mentally be able to support your needs at that moment. So if possible, it is recommended that you name two alternates on your healthcare directive. For those who have multiple family members, I know in many workshops, I've spoken to people who have multiple children, adult children, and they say, well, how could I choose? Or others have said, I would definitely want to choose one over the others for different reasons, but that's complicated emotionally in the family. These are all things to discuss and why we give some tips on how to talk about this with your family. Because legally, you can only designate one at a time. And your physician, whoever the physician may be in an emergency situation, needs to have one person to speak to. Now, they can be the spokesperson for the family. You may have a few people that you want involved in your decision making, but this is a legal document, and legally only one person can speak on your behalf, as is designated in your advanced healthcare directive. There's more information in your advanced healthcare directive about medical decision making. As I mentioned, you can add more forms, or in some of these other forms, designate additional wishes, values, treatments under certain circumstances that you would or wouldn't choose. And finally, the form, in order to be a legally binding document, needs to be either witnessed by two people or notarized. So completing your advanced healthcare directive doesn't need to cost any money at all. You don't need to do it through an attorney. Many who have done it through an attorney didn't have, it may be on file there, and they want to make sure that they have access to it in addition to having completed this as part of a trust or with an attorney. But you want to make sure you can have it notarized, or you can have two witnesses. And during this time of COVID, I know that there are neighbors completing forms and signing them over fences, social distanced, and there are notaries that are coming to people's gardens to notarize things. So lots of things happening. So the Advanced Healthcare Directive is the key piece to designate your healthcare agent to speak for you. Next slide. Next slide, Kelvin. So the other form that's part of your Advanced Healthcare Directives is the POLST, the Physician Order for Life-Sustaining Treatment. And this is a form in California. It's been around now for over 10 years and took quite a bit to coordinate between the physicians, the emergency medical services, and the law around life-sustaining treatment. If you were outside of the hospital, the Advanced Healthcare Directive designates a healthcare agent, but is not a physician order. And the physician order for life-sustaining treatment was developed specifically with people living with a critical or chronic illness in mind. That's who it was developed for. And as a document to be completed by your physician, that the same decisions about medical decision-making, about those medical interventions I mentioned, cardiopulmonary resuscitation, ventilation, comfort measures or care, all of these types of medical decisions are specific physician orders that you can go to your physician, have this conversation about the potential outcomes of these treatments if you were living with a serious condition now or a serious chronic condition, and you have concerns where there's a likelihood that given your conditions, your heart might stop, or someone with severe COPD, someone who is living with a cancer diagnosis, is currently under physician's care. It's important to consider having a physician order for life-sustaining treatment and have that conversation with your physician. The physician will complete this form and sign it with your decisions. And that then in California, it's a hot pink form that is meant to be placed on your refrigerator door. The purpose is so that emergency personnel coming in, if 911 were called and your heart had stopped, the different treatment options that would otherwise be required by law for emergency personnel to administer, if your choices were not to have some of these things done, then you have to have a physician order so the emergency personnel see that and will honor your wishes. For people who are concerned about some of the outcomes of these interventions and would not want them, it's critical that you have this document in place. And as I had mentioned, the only way this form is completed is with a signature from your physician. It is a physician order ordering emergency medical personnel not to follow these interventions that they would otherwise be legally required by law to do. I can answer more questions about that. So the physician order for life-sustaining treatment, also if you're living in a facility, a nursing home, etc., it's very important that you have had this conversation with your physician, have a copy of your decisions available and visible in your surroundings. Next slide. So these 4 steps, and I promised a whirlwind tour, which it is, and we'll certainly go back and answer questions, but think, talk, choose your healthcare agent and write it down and share your plans. What we have found is that many people have completed an advance directive or a living will as part of an estate plan, or even as part of healthcare planning many years ago. And it might be in a file. It's very likely that they've never talked to anyone, including someone who they've designated as their healthcare agent. So the person that they have designated doesn't know they've designated them, and they don't know how to honor their wishes, which is very unuseful. If you can imagine being designated as someone's healthcare agent, that means you're going to get a phone call at some point and be asked what you would have wanted, and you've not actually helped people to understand what that is in order to make decisions for you. We've also found that people, many times, if they've completed advanced healthcare directives years ago, those they've designated have moved or died, or maybe their healthcare situation and circumstances has changed over the years, and some of the decisions they made in the past, they might now change. So all of these are reasons to, once you have completed an advance directive, make sure that it's updated, just like you might update a will every 5 years or after major life events, that you are re-looking at this. And lastly, I do want to clarify the sharing. So the last step was write it down and share your plans. Once you have completed this cycle and you have written down and designated your healthcare agent, you want to make sure that you share these documents and that they're available to those who need them. So you keep a copy for yourself. You speak with your physician, and as we started with, it's recommended that you make an appointment with your doctor, and you can do this virtually now, even through COVID, specifically around discussing your advanced healthcare directive or the POST form. You can make a specific appointment for that. You can also request that a copy of your advanced healthcare directive be placed in your medical record, so that in case of emergency, it is there. If you're under the care and treatment of multiple physicians at this current time, or part of have a care team, you'd want to make sure, and we call this take charge for a reason, that you're ensuring that the people who would need to know that, and requesting that they do. Certainly your healthcare agent needs one, and we recommend having this conversation with your healthcare agent and close family members or your entire family as well, so that everyone knows who you've designated as your healthcare agent, what your decisions are, and where these documents are. Also, if you've traveled, although we're not doing a lot of travel right now, when we resume traveling, it's recommended that you keep a copy with you. I know certainly for hospice patients, when we have patients that are traveling, that we also coordinate, if someone's under medical care, certainly in hospice, but under any medical care, that you let the medical system where you're traveling to know that, and have a copy of your advanced healthcare directives. There are also ways with apps on telephones to keep your medical information. There currently is not a nationally designated repository for advanced healthcare directives. I know there are a number of systems and programs working on that. There are medical alert bracelets specific for advanced healthcare directives. So there are lots of ways that you can make it known that you have completed your advanced healthcare directive, and share it with those that would be in a position to support your wishes when needed. Last slide. So the 4 steps, very quickly, think about what matters most to you. Think about what matters to you for your wishes and values. Think about what matters most to you for your potential medical treatments. Think about what matters most to you for your spiritual and cultural values, or what has mattered to those in your circle of friends and family who may have experienced a serious illness or have died, and what are the things that you've learned from those experiences that might matter most to you. Talk about your wishes with your family, close circle of friends, both to inform them, to open this conversation, but also to help you discern who to choose to be your healthcare agent, which is number 3. You want to choose the person that you are going to designate to be your spokesperson if you are unable to speak for yourself, and make sure that they understand your wishes and values, medical decision making, and the key people that would be important, if there are those that you would want your healthcare agent to be informing or speaking to as well. Letting them know you'll be naming them on the document, completing your advanced healthcare directive, completing the POLST form with your doctor if that is appropriate for you, and making sure that your documents and these conversations are shared in a way that either your healthcare system or your physician will make sure that it is in your medical file with all of the people who need it, with your healthcare agent, and that you return to this and update as circumstances may change over time. So with that very quick whirlwind tour of advanced care planning, I will just say that in my personal experience, although this is can be a difficult conversation to start with family or friends, it literally is something that can bring both you and those around you, including we've had a physician help deliver this course at times, and he has said it's the greatest gift you can give your physician as well, to help achieve care that's aligned with your beliefs, your wishes, and your values. To have your advanced care planning done and have communicated this both as the best way to support the care that you want at the end of your life, and also to bring those around you peace of mind, knowing that they did what they could to honor your wishes and values. And at that, other than letting you know that at the end of the Q&A, we'll give you a web link to printed materials about what's been shared today and some additional tools. Let's move to questions.
Thank you, Mary, for spending this time with us. Mary was on a couple years ago, I believe. We had her on as a webinar guest, so we're happy to bring her back. We do have a ton of questions, so yes, I would like to get to them right away. First is a listener who wanted to know what actually would happen as a hypothetical. Say you don't have any of these documents lined up and you wind up in the hospital. Would the doctor with some serious condition where you're unable to list your wishes, would they just default into trying to keep you alive as long as possible? And then say if a family member shows up and there are no any kind of advanced care documents, would the family be able to advocate for you, or would they have really no legal power to do anything on your behalf?
Yeah, that's a very good question. Without an advanced healthcare directive, by law, medical personnel are required to do everything possible to sustain life. That may not align to what you believe is quality of life for you. And at times it can be very traumatic for medical personnel who know that it's some of the interventions might, if someone stopped breathing for a significant period of time, or actually significant is over 3 or 4 minutes, that there may be brain damage. There may be, if someone's a frail elderly person and CPR is administered, that's very likely that ribs can break, and it can be very painful and sometimes traumatizing to administer some of these treatments that were really designed for healthy, strong individuals, not someone who is seriously ill or frail. So in the case of not having an advanced healthcare directive, yes, they are required to, emergency personnel are required to administer CPR, which includes chest compressions. If you've stopped breathing, oftentimes intubation, and if they can't get breathing started again, ventilation. If no family are, if no one is designated to be your healthcare agent, and actually this is what we want healthcare professionals and emergency personnel to do in general, if we're fit and healthy, and the success rate would support returning back to good health. We don't want them to wait for a committee. We don't want them to have to track people down. They're trained to immediately work to support sustaining of life. Without a healthcare directive, they have to do that by law. Without someone designated to be your healthcare agent, when family are found, this is when it's sometimes the most traumatic for families, because if your family knows that there are certain things that you would never have wanted, most likely by the time someone is reached and they haven't been designated as your healthcare agent, they're put in a very challenging position. Now, healthcare staff will go to and learn as much as they can about your wishes from family members. But as you can imagine, legally, they're bound to continue treatments. And the best way to assure that if you have wishes other than that, that they would be followed is to make sure that that's written down and designated somewhere so that the family members can be supported and backed up by the documentation that you've given them. I hope that answers the question.
Thanks. We have another question. It was actually part of an earlier question. This is someone who it sounds like they might have limited resources financially, and also they might not have anyone they feel comfortable or confident reaching out to, whether it be, families of choice or relatives or friends. They don't feel comfortable choosing from their social or relatives.
Right.
And they have limitations financially. You did mention a fiduciary, but would that be something they might be able to use with very limited financial resources?
There are a couple of things that I would suggest. So, there are many people in that exact situation. I first would recommend that you really consider if there is anyone that you might ask or hold this conversation with, because many people do have someone that they might be able to talk to, but they might feel uncomfortable doing so, or need some support to reach out to someone. So that's first. Don't assume that there's that it's something that you can't have that conversation about, and that there might be someone in your circle. I know I talked to a woman that was part of a church group. People have been part of book clubs, and they'd say there's no one in their life, and yet there is, and all of us will need someone to be designated as a healthcare agent. So it doesn't have to be family. Having said that, if there is no one in your social circles, which is the case for many people, there are nonprofit organizations that support fiduciaries. There's one in the Bay Area, Jewish Family and Children's Services. There are also, and I don't know the fee structure, so you would have to do some research into that. There are also, with your advanced healthcare directive, I would still complete one and talk with your doctor. The legally binding element of your advanced healthcare directive is the naming of your healthcare agent, but you can complete an advanced healthcare directive and state your wishes and values and the decision-making. You can speak with your physician about completing a POLST form, which would be very important if some of these healthcare decisions are significant for you, and have those things in place. Make sure that they are part of your primary care physician and any healthcare system that you are in, and they will have the documentation about what your wishes and values are. You don't have the added benefit of having that advocate for you. But if you've spoken with your doctor and your doctor understands that, then they can acknowledge that those were your wishes.
Great, thanks. We have another listener who wanted to know what might be the pros or cons for designating someone who lives in a different state. Mm-hmm. And also, actually, someone asked, what about a different country?
Sure. The world has shifted to online everything in the last year, I think. So you can absolutely designate a healthcare agent who lives in a different state or a different country. You would want to make sure in your conversations with them a couple of things, and this is more in your conversation with the healthcare agent than in any other arena. Is your healthcare agent someone that would be comfortable advocating from a distance? It would mean that they would be on the phone or on a Zoom call rather than be able to see you more in person. Now, medicine has shifted dramatically in the last year with people having their phones or Zoom, so it's shortened that distance a lot for people. But you can designate someone out of state. You can designate someone out of country. The only other real concern around that potentially is the time difference. So if it's a country or it's just to be aware of the time difference, and you may want to have your second or third designee someone who's more local, or give the person out of state or country a local contact as well.
Great, thank you. I think we have time for maybe two more questions. We had a listener who wanted to know this question one more time. What might happen if the person they picked to be their decision maker actually disagrees with their wishes?
They're not the right person to be your decision maker.
So really, at that point, it's kind of too late, because they would have the legal authority to make decisions.
Yes, if their decision making contradicts what you have written, it could be a flag for the healthcare team. But in practice, the medical professionals will go with the decision making of the person that you have designated. So you really want to make sure they will honor your wishes and values. Having said that, there are a lot of gray areas in medical decision making, and if they thought that you might recover, or with the information that they were given, it's not always black and white. In fact, very rarely black and white in emergency healthcare situations. So, but if they were to radically go against your wishes and values, that's something to ascertain in advance, and it's something that I would ask your healthcare agent, or let them know how important it is that they not. If they were inclined to disagree with your decision making, you want to know that before you've designated them as your healthcare agent.
Thanks. And we have time for, I think, just one more question. And you've touched upon it a couple of times, but I just wanted to see if there are any other considerations people should keep in mind. In light of COVID-19, which is had a lot of social impacts and financial impacts, and
yes,
moving around and difficulty. Are there some things people should kind of keep in the back of their head in terms of working on advanced care planning during a pandemic? Not necessarily planning for COVID, but how COVID might complicate doing your advanced care planning.
Well, I will tell you, really, what COVID really, amongst many things, what it has brought to light is how critical having an advance directive is. And one of the things that happened is that, as you can hear through this session, there's a lot to think about and learn about and discuss about your particular care and potential outcomes. with healthcare providers to do this really well, and with your healthcare agent. And for people who didn't have an advanced healthcare directive and came into the hospital, oftentimes hospitals now will ask, do you have an advanced healthcare directive, or require that you complete one, or ask you to in the moment. And with people coming into the hospital with COVID who may not be able, may have immediately been put on a ventilator or not been able to speak for themselves, there was a real gap and there were a real issue in helping people to having to decide what someone would have wanted under the most dramatic circumstances during a pandemic. So one of the biggest things during this is to learn how important it is to do this in advance of a crisis. And if with the risk of any potential illness, I mean, none of us knows what potential conditions or illness, serious illness or sudden illness that we might contract. The whole purpose of advanced care planning is to have your wishes, consider your wishes and medical outcomes of different emergency treatments in advance. And COVID is one of those that you want to consider. If you were to get COVID, certainly at the beginning of the pandemic, and as things change over time with the outcomes, what's the likelihood of certain interventions or treatments for you? And so it's heightened the need for the conversation.
Great, thanks, Mary. I think that's all the time we have for today. Although we can see your contact information, and of course, Mission Hospice.
Yes, and Calvin, if I could just say one thing about that, my contact's there. Feel free to contact me. Hopefully, I can take a look at the chat and possibly respond. But the other, I wanted to let you know, the website at www.missionhospice.org/take charge has more information, a short video, a workbook, and the forms that have been discussed here online, so you can download them and spend more time with this. And I appreciate everyone's interest, support, and willingness to take charge. Please do.
Perfect. Thanks, Mary. Actually, that's what I was just going to mention, that visit your site to get access to the workbook. So
thank you. Thank you.
So I think that's it for today. I'm going to launch just a quick evaluation poll. We'd certainly appreciate your feedback. Let us know how we did today. I'd like to thank you all in advance for participating in today's webinar, which was presented by Mary Mathieson. Next month, we're going to have Barry J. Jacobs do a webinar on talking with medical professionals, so a related topic. You can find more about our webinars on our website, caregiver.org. We'd be happy for you to visit. So thanks again, everyone, for joining us. Thank you, Mary, for spending your morning and afternoon with us.
Thank you very much.
So this webinar is complete. We hope to see you back for the next one. And please, everyone, be safe and take care.